This is Average Joe PT, and tonight we're going to talk about good old-fashioned elbow pain. Elbow pain that won't go away. I'm going to give you some ins and outs, some treatments that you can do at home to help your symptoms. I had some comments. I talked to a person that I haven't heard from in forever, and he said he had some elbow pain, and so I'm going to give you guys some ins and outs on how to treat it. As well as I want to give a shout out to Kinesiotape that gave me my first brand shirt. So if you see this on the internet at all, or if you see that little icon in my videos, that's this picture. Average Joe PT, here we go. Three, that's what we're gonna do. There's 3 real treatments that you can do in the home to help reduce that elbow pain. Now that elbow pain, as you can see, has all these muscles. See that? Look at all those muscles that's lining this area. See all those muscles? Ooh, yeah. That's where your pain's coming from. Big time. Treatment number 1. Get a rolling pin. Some people in the clinic, we're going to work on our thumbs, or we might have a tool to use. But essentially what we're doing is we're doing a deep friction massage to those elbow tendons. Now you can do it. Now you don't want to use your thumb. It's going to make your thumb sore. Just take a rolling pin and just roll over that side. All right, now you can do it in standing in too if you wanted to, but I'm going to do it in sitting. Literally just kind of roll over the area. It's going to be tender. It's going to be sore. But you want to do that, try and work that tissue. Now, you might want to heat it first for a good 5 or 10 minutes to make sure that this massage pin, rolling pin, doesn't bother you as much. Needless to say, it's going to be sore because you're working that tissue. Treatment number 2. This stuff is called Kinesiotape. I've used it for years. People can go 50-50 on if this stuff works or not. I've used it on myself. It works, at least for the superficial tendons like this elbow problem. Now, they have rock tape, Kinesiotape, comes in 100 different colors. This stuff you can find on the internet for like $6 or $7. You can just get a small roll. You ain't got to get a big box like this, but just a small roll. All right, and I'm going to show you how you basically cut this and apply this next. Stay tuned. Subscribe. Here we go. Cut some strips. Just going to cut some strips out. And we're just going to bevel off the edges so it looks real pretty, so it doesn't pull up easy. The corners don't catch. That's the biggest thing. You ain't gotta look beautiful, but essentially you want to make it so these edges are beveled or rounded. Now, what you want to do is take that tape and you're literally going to go from where it starts and about halfway down the shaft of your arm. So that's what we're going to do. Literally, don't drop it on the floor. You're going to take one end, has a little line on the end of it. That's why you have a line on it. Plop it right at the elbow. Put it right over the top. Okay, that's kind of like our anchor point. And then we're going to put a stretch on it. Now, what I tell people to do is put the wrist in this position and then give it a nice little pull. Now, you can do 50%, 100% pull, whatever. But essentially, you're going to pull it good and tight and then just lay down the end. And then just kind of rub it a little bit so that glue kind of warms up in there. Number 1. Number 2, you're going to take the other strip and we're literally going to lay it over. So if this is your elbow bone, okay, you're literally going to do a thumb's width away from it. It's that simple. It's that simple, people. Not hard to do. You can do the exact same thing. Find the line on the other end of the paper. Drop it over. Lay it down. Give it a nice big pull. And then lay it down the other side. Let's see if I can get in the picture here, a good view for you. So that's basically it. This is essentially the same thing as the strap would do, where they put a strap around you, what we call a strain counter strain strap. There's 100 different kinds out there. This is kind of easy too, because you're going to take a shower and this just can come right off afterwards. I usually leave it on for about 24 hours. It probably won't last much more than that, just because you're washing your hands or just your skin gets oily. So that's treatment number 2, Kinesiotape. Any comments that you need help with? All right, I can kind of type it in and show you what you need down below, but that's basically the taping technique for, in this case, lateral epicondylitis or elbow pain. This is Average Joe. We're keeping it simple. Going to show you treatment number 3 right after this. Treatment number 3. Elbow extended, nice lateral view. Come out, elbow straight, and just get a nice little pull. Should feel a pull across the top of your forearm. Go to the point where you feel a pull, not pain. You're gonna hold that for 30 seconds to a minute. Relax, rinse and repeat. You're not wrenching your wrist. Just a nice little pull at the knuckles or just around what we call the dorsal side or the top of your hand, whatever you wanna call it. So that's stretch number 3. You don't want to do any strengthening until this tendon is calmed down. So we have the massage, cross friction, whatever you want to call it. You want to heat it up first. If it's really irritated, really acute, you've just irritated it, maybe you did a lot of typing or writing or whatever, you might want to ice it for 2 or 3 days and then try this technique. Let the inflammatory process drop down after about 72 hours and then start these 3 techniques. But these are the 3 essential ones. And then once your symptoms have gone down, then we can go in to do some strengthening exercises. If you want me to comment on that, just leave a comment down below. I can type it in. I can go into a next program and talk about what strengthening exercises you can do for lateral, or in this case, it could also be for medial epicondylitis. It would just be you move your wrist in a different direction. So, as Average Joe would say, look up and keep smiling.